Welcome to Adapting Class. This video is designed to explain those PA catheter values, what it means, what they indicate when they give you a patient in the question. What do you do with them? What are the indications? If you're preparing for your critical care nursing exams, this is something you have to know. This video will help you master those contents, the hemodynamic changes, and you can even make diagnosis from the values. Stick around and let me show you the key fact, straightforward content associated with this PA catheter. The first thing you have to know is the PA catheter is usually can tell you about the hemodynamic status of the individual, the fluid status, the perfusion state. I don't need to show you a picture because this is irrelevant, but you've seen it before. You know what it means, what we use it for. But the key thing is, what are those values? What can you get from those PA catheters? The first thing you can get that is common that everybody should be aware of is your central venous pressure. The venous system, as you can see, if I draw your heart like that, this is the right side of your heart. This is the left. The heart is divided into 4 chambers: right atrium, right ventricle, left atrium, left ventricle. The venous system is from the right side that drain into the right atrium. So you have a superior vena cava, the inferior vena cava. All the fluid in the venous system give you an idea about the individual central venous pressure. So what are those values? 2 to 6 millimeter per mercury. That's the pressure. What does it indicate? When they give you CVP, this is the same thing as the right atrial pressure. So it gives you an idea of the individual right atrial pressure, the filling pressure of the right atrium, which is the preload of the right atrium. This is the content you have to know. What is the implication then? If it increases, it means you have fluid overloaded, or you have right heart failure. If the pressure on the right side is increased because the right atrial pressure, you have right heart failure, or you have tamponade. Sometimes cardiac tamponade will present like that with the increased CVP because of the right-sided pressure. That's all. That's the first thing. Central venous pressure, normal, 2 to 6. If it's increased, your fluid level is high. If it's low, that means your fluid status is low. That's all. It can also increase the right atrial pressure. So that will tell you about the right-sided heart failure. That's the first thing. Second one is what? Right atrial pressure. I've given you the idea. This right atrial pressure is a representation of your central venous pressure, which is coming from the superior vena cava, inferior vena cava. So your right atrial pressure has the same implication of that is CVP. So that's why the numbers are the same. The right atrial pressure should be equivalent to the central venous pressure. And if it goes up, it means you have fluid overloaded, or you have right-sided heart failure, or you have tamponade. If you decrease, your fluid status is very low. That's all. What is right ventricular pressure? What does it tell you? The pressure here. You have to go from the right atrium to the right ventricle. What does the right ventricular pressure tells you? It tells you that your lung is in trouble, right? Because the right ventricular pressure, it tells you the status of your lung. That means if it increases, you have pulmonary hypertension. That means things are not going to the lung, so it's backing up into the right ventricle. If it's very high, it also means you have right heart failure. All of this, you have to think about it backward. That's all. These is the first 3 things you have to know. It's a pressure compared to the right atrial pressure and the central venous pressure. You have a systolic and a diastolic value because of the relaxation and contraction of the ventricle. So you have a systolic, which is 15 to 25. As it pushes against the ventricle, it pushes against the pressure in the lung. And then diastolic, that's the filling pressure from the atrium. So it tell you about the right ventricular pressure, and if it's high, pulmonary hypertension or right-sided heart failure. That's the first three that I want you to be comfortable with them. The next one, now we're going into the pulmonary artery itself. You know, from the ventricle, right ventricle, blood go to the lung, and you go through what? Pulmonary artery pressure, right? That's the pressure. It has a systolic and a diastolic pressure. What does it indicate? It indicates the pressure in the pulmonary system. The other way you can look at it is if the pressure is in the lung is high, then probably the left side is in trouble. So you're getting information from the left side. So if the left side has too much pressure, it will transmit into the pulmonary artery pressure. So it can also tell you about the left heart failure. So when you have a PA pressure is very high, it means what? Pulmonary hypertension or left-sided heart failure. Next one is the wedge. This is the true pressure, right? The wedge pressure, which is the pulmonary artery pressure, is different from the PAP. This is actually wedge, and it reflects, okay, the left atrium, not the lung, the left atrium pressure, right? Which is the preload of the ventricle, right? Is the preload of the ventricle. The left ventricle that get filled always depend on the left atrial pressure. And this left atrial pressure also depend on what? The wedge pressure, which is 6 to 12. And so we can tell whether the individual have what? Left heart failure or fluid overloaded when their wedge pressure is very high. Look, if your wedge pressure is very high, it means things are backing up into your lung from the left side, right? So it can tell you about the left atrial pressure. The additional thing you should know is if the valve, mitral valve stenosis, if there is stenosis here, the left atrial pressure increases, and then the wedge pressure also increases. The next one is cardiac output. The cardiac output is how much volume your heart pumps out every minute. Every minute your heart pumps, you see, you can put out 4 to 8 liters per minute. That's a lot. So your heart does a lot of work. Within a minute, it can pump out 4 liters of fluid or maximum 8 liters of fluid. Unfortunately, this does not tell you how your heart is doing because it does not tell you what is the relationship about the output and the individual weight. Like, so you have a tiny person whose cardiac output is what? 4. You have a bigger person whose cardiac output is 4. It does not give you indication. The next one that we'll talk about will give you a better idea whether your heart is doing a good job or it's not, because the volume that comes out should be analyzed based on your body surface area. So if you're big and you put it out 4 liters, you may not be enough because you may be big and you need more volume, right? That's why the range is 4 to 8. So it does not take into consideration the size of the individual. Of course, when the cardiac output is high, it's hyperdynamic, right? When it's low, that means you have heart failure. So hyperdynamic, that means you're moving very fast, you're using a lot of energy. If his cardiac output is low, it means you had heart failure, or you may have something related to MI. Nothing, your stroke volume is very low. So that is the difference. So this is the information you can get from the cardiac output. The one I like is the cardiac index. And this one is based on the output over your body surface area. Yeah, so this was 2.5 to 4.8. These give you 4.9. This give you exact idea of the individual. So the higher you can tell that now it can give you a precise information, and it take into consideration the individual body surface area, and it give you an idea of the better perfusion. So if you want to see if the individual is having good perfusion, check their cardiac index. The SVR, which is systemic vascular resistance, the range is between 800 to 1200. These indicate the afterload of the ventricle. Let's go back. So the left ventricle has to pump blood into the aorta. So blood has to go into the aorta, into the system. The pressure here, that is the pressure the ventricle has to overcome. So that's the afterload of the left ventricle. The pressure it has to overcome is 80 to 120, right? So if you clamp down the vessel, that is vasoconstriction, it means the SVR is going to go up. The ventricle has to use a lot of pressure to do that, right? And why would the SVR goes up? Either there's too much vasoconstriction or under resuscitated. You have hypovolemia, you have to clamp down to increase your pressure. If you have vasodilation, the SVR decreases. Or if you have sepsis, your SVR decreases because you have too much vasodilation. Those are the situations that will happen. The last one is pulmonary vascular resistance. It's not systemic, but this is pulmonary vascular resistance. If the SVR is the left ventricle, the SVR is afterload of the left ventricle, the PVR, pulmonary vascular resistance, is the afterload of the right ventricle. So this is the right ventricle pushing against the pressure in the pulmonary system to allow blood to flow. So what will increase that pressure is pulmonary hypertension. So the right ventricle has to push really hard. If you have a pulmonary embolism, there's blood clot in the vessel, the right ventricle has to pull. That's when it goes up. And so those are the things you have to know. Systemic vascular resistance is the afterload of the ventricle, while the pulmonary vascular resistance is related to what? The right ventricular pressure, right, against the pulmonary system. These are the information you have to know for the PA catheter called Swan Ganz catheter. You have to know what the CVP means, the right atrial pressure, right ventricular pressure, pulmonary artery pressure, the wedge pressure, the cardiac output, the cardiac index, the systemic vascular resistance, and pulmonary vascular resistance. You can make a diagnosis based on those values. You can tell this individual has sepsis, whether individual has what? Hypovolemia, if they have cardiogenic shock, if they have left ventricular heart failure. And so in summary, this is what I gave you. This is the way, all that I've said, this is the summary of the key fact. If your SVP, if your CVP is high, systemic vascular resistance, right? And then that means the right side pressure is very high and your wedge pressure is also high. Think about it. Your wedge mostly reflects the left atrial pressure, which can also reflect what? The left ventricular pressure, right? If your CVP is high, that means the right side, there's too much pressure on the right side, right? That is why, or the right side is not working. So you can have biventricular heart failure. You see, your right ICVP means the right side is not pumping the way it's supposed to. High wedge pressure, the left side is not pumping. So that indicates biventricular heart failure, right? If your cardiac output, that means your heart is not pumping enough and your SVR is very high, is constrict. Think about it. That means this is your heart, right? Your cardiac output mostly will come from the left ventricle. So if it's low, nothing is coming out, and your SVR is really high, right? It means the systemic vascular resistance. It means there's no fluid outside. In order to maintain your blood pressure, I have to increase your systemic vascular resistance. So either you don't have enough fluid or your heart is dead, cardiogenic shock. It cannot pump against anything. If your SVR is low, that means there's massive vasodilation and your cardiac output is high, that is sepsis or a vasodilation. And if your wedge pressure is low, that means the left side pressures are low. And if your SVP is low, that means your right-sided pressure are low. Both of them are low. That's hypovolemia. This is the way you can analyze. If you use this information, you can answer any question related to the PA catheter. Thank you for watching. If you need more, subscribe to Adapting this, and good luck in your exams. Thank you.